It is a known statement that incident atrial fibrillation is associated with an increased risk of dementia. But if I introduce a third parameter here, which is smoking, then what? Data on the association between smoking cessation after an atrial fibrillation diagnosis and dementia risk are very limited. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the risk of dementia after smoking cessation in patients with newly diagnosed atrial fibrillation. According to a new study published in the JAMA Network Open, smoking is associated with a significantly higher risk of dementia in patients with new onset atrial fibrillation, while smoking cessation after an atrial fibrillation diagnosis was associated with a lower risk of dementia than among the current smokers. Now let's go through this study in a little detail. Now we all know that atrial fibrillation is the most common cardiac arrhythmia with an increasing prevalence in the elderly, conferring a high risk of adverse cardiovascular outcomes and healthcare costs. Cognitive dysfunction is prominent among such class. This nationwide cohort study that I'm talking about included a total of close to 1,26,000 patients who had a national health checkup examination done within 2 years before and after an atrial fibrillation diagnosis. While based on their smoking status, the participants were classified as those who did not smoke, that was never smokers, ex-smokers, those who quit smoking, and current smokers. Patients were followed up until dementia, death, or the study period, whichever period ended first. The results of the study showed that 51.9% were non-smokers, 27.5% were ex-smokers, 7.1% those who quitted smoking, and 13.5% were current smokers. During a median of 3 years of follow-up, dementia occurred in close to 5,900 patients. Hence, the researchers concluded that although smoking is associated with a significantly higher risk of dementia in patients with new onset of atrial fibrillation, but if the smoking stops, if there is smoking cessation after an atrial fibrillation diagnosis, that was associated with a lower risk of dementia than among the current smokers. These findings may support promoting smoking cessation programs to reduce dementia risk in patients with new onset atrial fibrillation. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.